Hello everyone, welcome to QAxon. So in this video, you will learn about neuromuscular blockers. Under this topic, I will be discussing the classification of neuromuscular blockers, and we will also study the mechanism of action of these molecules. We'll also look into a few examples. So here we go. So what are neuromuscular blockers? These are molecules which block transmission of impulses across the neuromuscular junction, leading to muscle paralysis. So this can result in respiratory paralysis also, and in that case it is fatal. So historically, the oldest known neuromuscular blockers were poisons. For instance, curare was a crude plant extract which was extensively used in South America as arrow poison. This would cause death by respiratory paralysis. It was much later that scientists started to isolate these molecules and evaluate their potential as drugs. So what is the role of neuromuscular blockers as drugs? Now, in clinical use, these molecules are mainly used in the context of surgery as adjuncts to anesthesia. These produce muscle paralysis and relaxation of skeletal muscles, which is beneficial during surgery. This also paralyzes the vocal cords and allows easy intubation of the trachea. However, when we use neuromuscular blockers during surgery, mechanical ventilation must be provided to the patient in order to maintain respiration because there would be respiratory muscle paralysis. Now, how are neuromuscular blockers classified? So if this is the neuromuscular junction, these drugs could either act on the axon terminal. Then we call them as presynaptic neuromuscular blockers, or they could act on the cleft or on the motor end plate, in which case we call them as postsynaptic neuromuscular blockers. So broadly, neuromuscular blockers can be divided into presynaptic blockers and postsynaptic blockers. Now, the classic example for presynaptic blockers is the botulinum toxin. Postsynaptic blockers are further categorized into competitive non-depolarizing blockers such as curare and galamine, competitive depolarizing blockers such as succinylcholine, and finally, choline esterase inhibitors such as organophosphate compounds, neostigmine and physostigmine. Let us now study these molecules in more detail. Now let's first study the botulinum toxin, which is an example of a presynaptic neuromuscular blocker. Now this is a toxin released by the bacterium Clostridium botulinum. So how does this molecule act? Now we know that for normal neuromuscular transmission, the process of docking is very important. When the action potential arrives here, there is opening of the voltage-gated calcium channels, there is entry of calcium ions, and calcium ions mediate the docking process with the help of additional docking proteins. So the acetylcholine vesicles are docked to the cell membrane, and then there is release of the acetylcholine by exocytosis. Now, botulinum toxin interferes with the docking proteins, blocking the process of docking. And therefore, there is no release of acetylcholine, and this leads to failure of neuromuscular transmission. So this is how muscle paralysis is brought about. Now let's look at curare, which was traditionally used as arrow poison and which is one of the oldest known neuromuscular blockers. So how does curare act? Now curare is a competitive inhibitor, which means that it structurally resembles the acetylcholine molecule. So it binds to the nicotinic receptors. However, It does not have any functional resemblance with acetylcholine. It does not perform the actions of acetylcholine. Therefore, there is no depolarization, and this causes muscle paralysis. So we classify Curare as an example of a competitive non-depolarizing neuromuscular blocker. Now, the disadvantage with Curare is that once it binds to the nicotinic receptor, the binding is irreversible. This leads to muscle paralysis, which can be reversed only when fresh nicotinic receptors are synthesized, and that would take some time. So in this period, if the patient is not provided with ventilatory support, the patient can die. And that is why Curare causes death by respiratory paralysis. So traditionally it was used as a poison. On the other hand, Galamin, which is also an example of a competitive non-depolarizing neuromuscular blocker, acts in a fashion similar to Curare, but it is reversible. The binding with the nicotinic receptor is reversible. So this molecule would detach from the receptor after some time, and therefore it is safe to use Galamin as a drug. In fact, it is used as a muscle relaxant during surgery. Now let's study the next category of neuromuscular blockers represented by succinylcholine. So how is succinylcholine different from Curare or Galamin? Now, succinylcholine also resembles the acetylcholine molecule, but then it resembles this molecule both structurally and functionally. Therefore, it binds to the nicotinic receptors and it also causes depolarization. However, unlike acetylcholine, it is not sensitive to the action of cholinesterase, which means that it cannot be broken down by the enzyme cholinesterase. So what happens because of this? Now, the free succinylcholine is not broken down by cholinesterase. Therefore, the bound succinylcholine cannot detach from the nicotinic receptor, and this causes persistent depolarization of the muscle. This is why succinylcholine is categorized as a competitive depolarizing blocker. So when there is persistent depolarization, the muscle is in a state of sustained contraction. There is failure of generation of a new action potential. Therefore, there is muscle paralysis because the muscle is in a state of sustained contraction and cannot respond to another action potential. Now let's try and understand the last category of postsynaptic neuromuscular blockers, that is cholinesterase inhibitors. One of the examples of these compounds is the organophosphate compounds, which are commonly components of most pesticides. Now, how do these organophosphate compounds act? So, these molecules block the enzyme cholinesterase. And because of this, the free acetylcholine in the cleft is not degraded. Therefore, the bound acetylcholine cannot detach, and this leads to persistent depolarization and therefore muscle paralysis. Now the thing with these compounds is that they bind irreversibly to the cholinesterase, which means that their effects would last until new molecules of cholinesterase are synthesized by the body. So in this period, if the patient is not supported with a ventilator, there could be death due to respiratory paralysis. So these molecules are typically poisons. On the other hand, neostigmine and physostigmine are also cholinesterase inhibitors, but they are reversible cholinesterase inhibitors, which means that they bind reversibly to the enzyme cholinesterase, so their effect is short-lasting, and therefore they are safe to be used as drugs. In fact, they are used in the treatment of myasthenia gravis. With that, we come to the end of this session. Thank you.